Another great day to be on the Don Bullock Morning Show. Thomas McDowell always brings us just wonderful information and data, and we welcome him again. So, Pharm To Home, let's talk. What's your conversation piece today?
Well, thanks for having me, Roger. So today I was going to touch on some legislation that passed at the state level on July 1st.
And I want you to listen carefully.
So some really, I think, great, potential benefits from this legislation directly to the consumer. There's a lot of things that pass that might seem like fluff or never really affect consumers, but this is going to be something that is directly correlated to access to health care and easy access. Hopefully, in our area, but throughout the state. So recently, House Bill 67 passed in the state level, not at the federal level. So this is North Carolina related only, although there are some other states doing similar things. But there was a health care worker reform package that passed. And like a lot of bills that come through legislation, a lot of things get added, pulled out. It can become something much different than when it first started. It's kind of like an avalanche sometimes. And then a lot of things at the last minute often get stripped out. And that's often been the case for pharmacy. We've got some good things going on at the federal level, but then some other controversial issue will pull the whole bill out of play. But this one passed, and the main provision that I think is going to be most impactful on the pharmacy side, no doubt, is testing to treat, test to treat. And so that verbiage means pharmacists can test for flu and actually treat for flu. And so that's really revolutionary.
And that cuts a step out.
Cuts a step out that really most doctors, PAs, physicians, NPs, et cetera, are excited about, because they usually
I'm sure, because that's so time consuming.
Time consuming, and it fills their offices with sick people. They usually are in the business of chronic disease state management, chronic care, long-term care, diabetes, hypertension, heart failure, kidney disease. They don't necessarily, it can really be a challenge to incorporate all of those acute, urgent situations. And a lot of those patients end up having to go to urgent care or anyway, because it's hard to get into your primary just like that when you start having cold or flu symptoms. So it's really a win-win situation, because you kind of pull that patient out of the waiting room at the doctor and get them access to care quickly. Pharmacists and pharmacies are looking for different ways to care for patients beyond dispensing product. So we're really excited about this. In the past, pharmacies we can test for flu, but we couldn't treat for it. So if the patient had a negative test, that's great. They have peace of mind. They got access to a quick point-of-care test at the pharmacy. But if they tested positive, there was
then they have to go somewhere else.
They have to go to the doctor typically. And
well,
so
that's expensive for them.
And so they're paying the pharmacy, or potentially insurance might cover it, and then they have to also do a visit with the doctor. So that was just something that it was a lot of friction there, a lot of steps. So that would turn people off.
That was government.
And it would turn people off from getting tested, because they just, I might as well just go to the doctor, because if I'm positive, I need them to write me a prescription for Tamiflu. Now they can go to the pharmacy, and not now. This is coming. I should say that the protocols are being built. Hopefully later on in the fall, this will
by the time
go
the
live.
season.
Yeah. So you can't go into a pharmacy. Let me make that clear. You cannot go into a pharmacy right now and get tested and get treatment yet. But the legislation is in play now. It's the building the protocols and getting everything geared up. And then the pharmacies have to implement, and that takes time. So hopefully we'll be able to do it in the fall at Medical Park Pharmacy and McDowell's Pharmacy. We try to be innovative and progressive and early adopters, so we're looking to get into that space. But the reason it's really beneficial is pharmacies, in my opinion, are often the most accessible healthcare providers in their communities.
Well, they're more family friendly.
Well, it's easier to get into. You can call and reach me, and most providers in the physician space have appointment-based models, and they're super busy, seeing lots of patients.
People waiting hours.
And so we can get in. We can get patients in and help them in the pharmacy usually pretty quickly. So the main thing though is now we can actually administer treatment.
Well, that's good news whether you have it or not.
Yeah.
I mean, because somebody in the family is going to be affected.
No doubt. And then also another piece built into the protocols, I believe we should be able to also prophylactically treat. So if somebody's been exposed and is high risk for catching it from the exposure, we can administer and provide prophylactic treatment. Because with Tamiflu, there's treatment dosing, there's also preventative dosing.
Oh, really?
To try to prevent catching it after you've been exposed. So there's a whole lot of people that can be helped from this, and the accessibility remains the key. If we can get you in as a walk-in,
Well, time is your most valuable asset. And if you don't have to spend 2 or 3 hours, and that's what it would take to go to the doctor, because you have to travel, you have to sit and wait, you have to go in, and he'll spend 5 minutes with you, write a prescription, and charge you for that, and then go back to the pharmacy.
Yeah. It's a lot of steps there. And so now you're in the place where you get the medication. And
That's wonderful.
And this is something that, going through legislation that the medical board at the state level and all the medical associations, et cetera, the overwhelming majority of folks are in full support of.
Well, it sounds like, because the physician is going to be able to spend time with the people that are really sick. And I don't mean that flu is not sick.
Yeah.
But
the complex stuff.
and for his practice, that's better.
The diagnostic, the keeping them healthy long term. This is a built-in protocol that will have oversight from the state health director, who's a physician. And so it'll be very clearly written out of what can and can't be done. And the pharmacist, if they're participating, will follow that protocol. And with flu, it's pretty standard. If you catch the flu within 48 hours of symptom onset, Tamiflu is the go-to typically. And the key is with that, to administer it, you do have to, the symptom onset needs to be within 48 hours, because Tamiflu is virtually useless after 48 hours.
Is that right?
Of symptom onset. And just to be clear, a couple of things on Tamiflu. It does not eliminate the flu. If you catch it, if your symptoms start and you get tested and you start Tamiflu within 48 hours of symptom onset, you can shorten the duration of your symptoms.
Well, that's
a
good
key
too.
point.
But you think perhaps by fall, a latter part of fall.
October 1st is when the actual legislation becomes active. So it's been signed by the governor. October 1st is the active date. But in the meantime, there's protocols and steps being worked on right now in order to try to go live that day.
And you think perhaps that this will be covered through some insurances?
That's a great question. So that will be interesting
to see.
The language in the bill designates pharmacists as healthcare providers, and an issue just historically with pharmacists is at the federal level with like Medicare, for example, we're not viewed as healthcare providers. Therefore, we cannot bill on the medical side.
But now they may.
This should open up some avenues to contract.
At least it's on the agenda.
Horizon, yeah. Now, the insurers, how quickly they will adopt that.
Well, this should be cheaper.
Or
less expensive.
Yeah, definitely than going to the ER and the urgent care.
Yeah.
Because we would be billing something much less in cost.
You see what I'm saying? I think economically that's like breaking a windshield with a pebble and you just
Yeah.
get it replaced.
Yeah, and so you're lowering the severity level of the visit, which is what insurers
Yeah.
care about. It's what patients care about from an economic standpoint. And so when you reduce the severity level of the visit, everybody wins. The patient, the insurer, pharmacy gets to jump in there. Honestly, these hospitals and so forth, they don't want a ton of ED utilization on
None.
stuff that's not actually super severe.
Well, as I say, multiple charges rather than, well, Thomas, you see Thomas's number there, and I think that's there for a reason.
Yeah.
So if you have any questions about this as you go on, I'm sure you could answer or have someone answer it.
Sure.
I'm going to change the topic just for a second.
Sure.
Because it's been brought to my attention that apparently strands of the COVID virus is popping up more often right now than a custom, and I don't know what strand, I don't know what it is. Maybe you could elaborate. There may be someone or someones out there that may be experiencing this thinking it's a cold or.
Yeah, so we continue to see some fluctuations and upticks, and right now we are seeing patients still contracting COVID. We just can't seem to kick this thing into a seasonal virus. I mean, we don't want it at all, but we kept thinking for years that it would turn into a fall and winter-based virus, and it continues to be an issue throughout all seasons. And most viruses really struggle to spread during the summer months. They really spread like the flu and RSV more so during the fall, and we just cannot seem to
Shake it right now.
Shake it, and so we're continuing to see, patients affected by this. I think it is kind of a strain that I'm not aware of a brand new strain. So I think it continues to be a pretty similar version, but there's always genetic mutations going on, and that's how this virus has really been difficult to manage because it seems to mutate a lot, and that's where it avoids the immunity that a lot of people have, and so you get it again. Your body is tricked by a new mutation, a variant of the virus, and then you get it again because people just keep getting it over and over again, hopefully less severe. So that being said, hopefully it'll eventually kind of die down, but we're going into the fall now. I don't expect it to die down right now. It'll probably tick up as we head into the fall and winter. And so if somebody is out there looking for the vaccine, there's going to be a slight tweak in that variation coming out in the fall if folks are interested in that. They keep changing the formulation and so forth. And it continues to be an issue. There is some treatment out there for it, with Paxlovid. It is super expensive now. In the past, another barrier. In the past, it was funded by the government, and so everybody got it for free. Well, that's not the case anymore. It's commercialized. It's wholesalers and big pharma putting prices on it. It's over $1,000 list price drug.
Really?
Mm-hmm.
You're kidding?
Now insurers are covering some of it.
Well, our president is trying to approach the pharmaceutical side to make it more competitive with the rest of the world.
Yeah.
And it appears that he has been successful in some. Pfizer's some of the pharmacists are really cutting back.
Yeah, and I think folks are kind of rethinking on the pharmaceutical manufacturer side how they're going to do things. Because, for example,
that middleman still.
Yeah, the middlemen.
That middleman.
They want their money.
Yeah, they're the ones that are making the wealth.
One thing that just shows what some folks are doing is there's Novo Nordisk, who's a big manufacturer.
Yeah.
They make Ozempic. Well, they just announced their.
Now they have theirs in Zebulon, don't they? Is that where their location is manufactured?
That might be GSK.
Yeah, I think you're right.
And Novo, I think, has some stuff in Smithfield, maybe.
Maybe that's it.
Or Clayton or
I
something.
know they have some
They're
somewhere.
based in Europe, but they have some stuff in North Carolina, I think. Well, they just announced that they are going to be offering Ozempic, the popular GLP-1 agonist that's primarily used for diabetes, but also people like the fact that it can cause some weight loss, but it's not indicated for weight loss. Super popular drug. They are announcing they're going direct to consumer through a program called NovoCare, where they're going to sell cash Ozempic $499. Now, the list price of that drug is almost double that. So tell me how they're offering that direct to the consumer at that price. That means they're inflating that price because there's so many middlemen, wholesaler,
right.
PBM, pharmacy benefit manager, insurers.
Well, that's what I have heard is that
Now it's
I
still-
did not know how the process worked, and you may have been the one that shared that with me.
So that shows the inflation of that drug.
That's right.
To account for all the middlemen, and that means that Novo is producing that drug at significantly less than $4.99 because they have to make a margin.
Well, that's right.
And they're inflating it up to double $4.99 to
That
make
the
money.
American consumer still pays.
No doubt. The patient's left on the hook. The pharmacy is right there with the patient, especially independent pharmacy, because we're at the bottom of the food chain. The pharmacy benefit managers, the insurers, and the wholesalers and Big Pharma are all just, taking money from a corporate C-suite.
Yeah.
And not even affecting the care. The care happens with the prescriber, with the patient in the pharmacy, and they're left with breadcrumbs.
Well,
There's a lot there. I
Yeah.
could go on about that for a long time.
Thomas, I appreciate you being with us this morning. I appreciate so much your continued education, because you have educated our viewers on so many things. But this is a very positive, and I'm glad I heard and picked up on the COVID, because some people may be thinking, had forgotten about the possibilities.
And hopefully on the COVID, we were trying to get that into the bill, but it's just flu for now. I hope in the future there might be some possibility where we add on strep and COVID for test and
Well,
treat.
those are pretty.
So being able to test and treat for strep throat, being able to test and treat for COVID too. But right now it's just flu, and it's not live yet, but hopefully in the future it will be. Follow us on social media at Rocky Mountain Medical Park Pharmacy, Facebook, Instagram. We're keeping people posted on the services we offer. Stop by and see us at the Medical Park Building, 901 North Winstead Avenue. Across from the future site of Slim Chickens.
Yeah.
That'll be one of our new geographical identifiers. And our number's here on the screen, 443-7979. We'd love to be your pharmacy. We're a full-service pharmacy, not just for the building.
And deliver free.
Deliver for free. We're not just serving Boyce Willis patients. We're in that building, but we serve all of the Rocky Mountain area.
And it's all about relationships, whether you're raising money or seeing your physician or your pharmacy or whatever. But Thomas, we appreciate you again being with us, and if you have questions, let us know. Take the number. If you call me, I may give you something different. But anyway, with that, we'll be back shortly.
Thanks, Roger.